Hello and Assalamu alaikum. My name is Haris Abdurrahman and I'm from the uh, fifth prof morning. And my topic for my topic is rational and irrational drug use. The drug given to me is activated charcoal, and I'll be talking about it. So, activated charcoal is the topic. So, what is activated charcoal? Activated charcoal is a fine, odorless black powder often used in emergency rooms to treat overdoses. It has toxin absorbing properties, uh, and it is majorly used as an antidote. So, some of the indications are stated below, which are the following: it is antidote for poisoning, flatulence, for high cholesterol, for upset stomach, and for bile flow problems during pregnancy. Okay, so generally the activated charcoal is safe for the adults when it is used in in a proper manner, in a controlled manner. Like everything else, also has side effects, which include which includes constipation, black stools. More serious but rare side effects are swelling or blockage of the intestinal tract, regurgitation in the lungs, and dehydration. Okay, so as I've told you before that it is used as an antidote. So its dosage is stated below. Uh, for the adults, the dosage is different, and for the children, the dosage is different. So for the adults, it's 1 gram per kg, uh, 25 to 100 grams orally, alternatively 10 grams charcoal. It's commonly used with sorbitol, uh, and multiple dose regimen every 2 hours or 50 grams every 4 hours without sorbitol. So you can um, give it like you can give 25 grams of this activated charcoal and 25 grams of sorbitol every 2 hours, or you can go with 50 grams every 4 hours without sorbitol. It's up to you. And for the pediatric poisoning, suspensions are given to the infants. Uh, 1 gram per kg is the dose orally, uh, which can be repeated for every 4 to 6 hours. For children, it's 1 to 2 grams per kg. The dose orally may repeat it every 4 to 6 hours. For adolescents, 5 to 10 times the estimated weight of drug chemical ingested orally, and you can give it repeated every 4 to 6 hours. Okay, um, here are some of the drug interactions that activated charcoal has. So it has moderate interaction with acetylcysteine, citalopram, which is an antidepressant drug, digoxin, methotrexate, and theophylline. These are some of the drugs that you must be careful with when administrating activated charcoal. Okay, okay. The content indications are you should not be using activated charcoal if there is an intestinal obstruction, or uh, yes, if there is intestinal obstruction, you should not be using activated charcoal. It has no short-term effects and no long-term effects. Um, there are following cautions that must be kept in mind when you're taking this particular drug. Vomiting may occur. Uh, Caution patients with decreased peristalsis and and effectiveness of activated charcoal, sorbitol, or other catharatics may increase risk of significant electrolyte abnormalities. And capsules and tablets are not recommended for treatment of poisoning. Product containing sorbitol not for use in patients with fructose intolerance. So if you're a patient and you have fructose intolerance, you should not be using sorbitol. It is not effective with alcohols, and it is not effective with alcohols, caustics, iron, lithium, heavy metals, and mineral acids. For pregnancy and lactation, you should consult your physician for this. Okay, so what is an alternative for activated charcoal if it's not available? Use of burn toast as a substitute for activated charcoal is the universal antidote. Um, its irrational use um, its irrational use may decrease absorption of certain nutrients. So you should be very careful when using this uh, product. Brands available are carbon tablets 250 mg and carbon 260 mg capsules. Okay, let's move forward and let's hop on to the case study. So a 3-year-old child presents to you emergency department with his parents after ingesting an unknown quantity of furosemide. Approximately 90 minutes ago, the most child could have ingested is 10 ml. The child's older sibling has a history of congenital heart disease. The child did not ingest any other medications. The child had no vomiting, diarrhea, or change in behavior since the ingestion. The child has wet a large number of diapers. PMH, none. Physical examination, okay. So these are the physical details of the patient, and furosemide is basically a diuretic, and this child has ingested um, a fairly sufficient amount of this diuretic, that's just 10 ml, and we have to suggest a treatment. Okay, so the questions are: what type of decontamination is indicated? What are the complications which may be associated with this type of overdose? What management strategies should be used? Okay, so we look into this case studies. The next slide. Okay, so the subjective part, which says that the patient is alert and oriented. This heat examination is normal, pulmonary clear to auscultation, CV regular rate and rhythm without murmur, abdomen soft and non-tender, neurological GCS is 15, criminals 2 till 8 intact, skin normal, capillary refill. So basically it appears that there is no such problem, and the patient appears to be normal. The heart rate, however, is 142. The respiratory rates, the BP is low on the lower side. Okay, so what would be the assessment? The first question was, what type of contamination is this patient requires no decontamination. However, activated charcoal can be administered in the setting of diuretic poisoning if the conditions are right. So basically it appears that the patient has taken the amount a sufficient amount of diuretic, but it is not to that extent which requires the decontamination process. So it appears that there is no decontamination. So what should be our plan? So the loop diuretics such as furosemide, they mainly affect, the major effect they have is on the electrolyte imbalance and dehydration, such as hypokalemia, hypercalcemia, hypomagnesemia, and hyponatremia. Okay, so these are the main major problems that are encountered when someone ingests loop diuretics like furosemide. So what should be the strategy? So there are no antidotes for diuretic poisoning. The management should focus on stabilization of the airway, breathing, and circulation. Particular attention should be paid to fluid and electrolyte correction, because that is what loop diuretics affect. So you should try to administer the patient with sufficient fluids and electrolytes so that the normal homeostasis of the body uh, is maintained. Okay. So rapid correction of hyponatremia in patients with seizures and coma can be performed with hypertonic saline. However, correction of hyponatremia should be cautious in chronic abuses to avoid osmotic demyelination syndrome. Continuous cardiac monitoring is recommended until serum potassium is corrected. So this was the case study, and this will be the end of my presentation. Hope you like it.